So, starting with today's lecture, we started the topic local maladies or local diseases, that is from aphorism number 185 to 203. So, in this, we completed up to aphorism number 295. So, before moving forward, first we will revise what we studied in previous classes about the local maladies. So, in this, Uh, we started with aphorism number 185, and in this aphorism 185 they explain about the definition of local diseases. That is, local diseases are those diseases which are manifested on the local parts, on the external part of the body. Rest of the body besides the affected part appears as if in a perfect state of health, but it is not so. That we call it as a local diseases. Then in 186 we studied about the aerodynamic local diseases. Means, what are the aerodynamic local diseases? These diseases which are due to aerodynamic cause, which the homeopathic physician has to treat with the help of aerodynamic medicinal agents, that we call it as a surgical treatment. And in this the homeopathic physician can give pre and post operatively the dynamic homeopathic remedies. And in this aphorism 186, they explain the different causes of aerodynamic local diseases. That is, for example, injuries from external material cause, dislocation of joints, then lacerated injuries, extraction of foreign bodies that have penetrated into the living parts, then fractured of bone, etc. So these are the aerodynamic local diseases. Then in 187, they explain about the dynamic local diseases. Excuse me. Dynamic local diseases are those diseases in which there is manifestation of the disease on the external part of the body, but it is because the dynamic morphic agent they are called as a dynamic local maladies. So in this, the dynamic local diseases, it having the examples like warts, erysipelas, etc. That is, that having the appearance on an external part of a body, but the cause is internal. In this, it is a pernicious mode of treatment to treat such diseases with the help of a dynamic medicinal agent as a remedy. In this, one or two very few symptoms are there. If they are palliated with such measures, the physician becomes handicapped for selection of a remedy. So this is explained about dynamic local diseases in aphorism number 187. Then aphorism number 188, it is regarding the local disease manifestation. So what is local disease manifestation? As in local disease, we see the manifestation of disease is only on the external part of the body, and in which the rest of man appears as if in a perfect state of health. So in this is the misconception, that is, the disease is present on only the external part of the body, but in this the internal part of a body also gets affected. This is explained in aphorism number 189, that is, they explain it as a, if one part of a body gets affected, the other part of a body also get affected, as there is a connection between each and every organ in the body. And in homeopathy we treat the human being as a whole and not his particular part or organ in the body. So nothing exists in the world without any cause. This is the theme of aphorism number 189. Then in aphorism number 190, they explain about the treatment of local diseases. So what is the treatment of local diseases? It is again divided into for the aerodynamic local diseases and for the dynamic local diseases. So treatment of local diseases of aerodynamic nature, it having treated with the help of aerodynamic agent, that is, with the surgical help or the other mechanical help as a remedy. And but in dynamic local diseases, they should be treated by taking the local symptom into account as well as symptoms of a whole being into the account. So in this, they took this In dynamic local diseases, they took the symptoms of external part of a body also, as well as the symptoms of a whole being, and they form the totality of these local symptom and the whole being and form the portrait of disease. That portrait of a disease can be matched with the portrait of a medicine, and the medicine is selected for these dynamic local diseases. Then in aphorism number 191, they explain about the sign of cure. What is the sign of cure after giving the treatment to these local diseases? So in this, the sign of cure is the symptoms of whole being are taken into consideration after proper formation of portrait of the disease. In this, the symptom of whole being are taken into consideration after proper formation of portrait of the disease, and if we select the proper homeopathic remedy, there occur improvement in the general health of the patient as well as the local disease signs and symptoms also gets eradicated. So what is the sign of cure in these local diseases? That along with the removal of local sign and symptom, there is a improvement in the general health of a patient. So this is the sign of cure that is explained in aphorism number 191. Then aphorism number 192, it is regarding the what is the true homeopathic remedy in local diseases, or how to select the true homeopathic remedy in local diseases. So in this, for selection of a true homeopathic remedy in such diseases, or in such cases, peculiar signs and symptoms of the affected local part should be noted down, as well as changes in health of a man as a whole prior to use of any medicine. Combinedly, portrait of a disease is formed and proper homeopathic remedy is selected. So, how you select the true homeopathic remedy or a proper homeopathic remedy? As you have to note down the local symptoms, which are the peculiar symptom in these local diseases. So, recording of a peculiar signs and symptoms of affected local part along with the changes in a state of health of a man as a whole, that is prior to the use of any medicine, and you have to combinedly form the portrait of disease is formed and the proper homeopathic remedy is selected. So this is given in aphorism number 192, that is the true homeopathic remedy in local diseases. Then aphorism number 193, it is the proof regarding the local diseases. That is, local diseases are affected not only on the external part of the body, but it can affect the internal part of a body also, as when we select the medicine on the basis of local symptom as well as the human being as a whole, and you give the medicine to the patient, in this case the total health of a patient gets improved. This is the proof that the local diseases are not caused due to only the external causes, but it can be caused due to the internal causes. So this is given in aphorism number 193. Then aphorism number 194, it is regarding the use of external application as in a local melodies or as a local melodies. So in this, the external application on the affected parts both in acute as well as in chronic local diseases, when they are not caused by external violence, are not at all admitted, but treatment of such diseases should always be done with internal dynamic homeopathic remedies, which gets indicated on the basis of symptom similarity from general class of proved medicine. So when the disease is of acute nature, or it is of a chronic nature, or a acute local disease or a chronic local disease, in that case the external application is not allowed if the disease is of a dynamic local disease, as when you use the external application, in that case the symptoms get disappear and nothing will be remain in the hand of a physician. So in the local diseases which are caused due to the dynamic causes, in that you cannot use the external application as a mode of treatment. So in this case you have to prescribe the medicine on the internal dynamic homeopathic remedies. You have to prescribe which is based on the symptom similarity, which is from the general class of proved medicines. And for the cure of these diseases, that is in acute diseases, if the symptoms are not get eradicated with such a medicine, physicians should take into consideration that now sora is fully developed and the patient is in need of deep acting antisoric remedy. So to complete the action of these medicines, you have to give the deep acting antisoric remedies in these cases. So in aphorism number 194 they explain about the use of external application in a local maladies. Then in aphorism number 195 they explain about, that is, local maladies and the removal of cause. If there is a local maladies, how you have to remove the cause of that disease. So in this, that is, after removal of acute local maladies with the help of an internal acute acting medicine, the patient should be treated with a deep acting antisoric medicine in order to have radical cure of acute local maladies. In the similar fashion, non-mineral chronic local maladies should be treated. So in this, to remove the cause of a disease, that is of dynamic local diseases, you have to prescribe the deep acting antisoric medicines to complete the action of these medicines, or to cure these local diseases. That may be an acute local disease or it may be a chronic local diseases. So to complete the action of the previous medicine, you need the deep acting antisoric medicine in these cases. So this is the local medicine and removal of a cause. So in previous lecture we completed up to aphorism number 195. Now in today's lecture we are going to discuss from aphorism number 196. So first I will read the aphorism number 196. It might indeed seem as though the cure of such diseases would be hastened by employing the medicinal substance which is known to be truly homeopathic to the totality of the symptoms, not only internally but also externally, because the action of a medicine applied to the seat of a local affection might effect a more rapid change in it. So in this aphorism, that is aphorism number 196, it explained about the use of a same medicine internally as well as externally. So in this, when homeopathic medicine which is indicated on symptom similarity is used internally as well as externally, there is too early cure. So in this aphorism number 196 they explain as the use of same medicine, that is, if you use some medicine it can be used internally and externally, as there is a too early cure, but this is not advisable, or it is an inadmissible, that is not accepted by the homeopathic law of cure. So in this aphorism number 196, they explain, that is the use of same medicine. If you are using the Nux vomica can be used externally also, internally also, and you can use it as a externally also, as a in the form of ointment, liniment, etc. But this is not advisable in homeopathy. This is given in aphorism number 196, sorry, 197. In 196 they explain that you can use for the rapid cure or a early cure, but it is not accepted, that is given in aphorism number 197. So use of a same medicine internally as well as externally, that causes the early cure, but this is not accepted. So in aphorism number 197 they explain as, that is, this treatment however is quite inadmissible, means that is not accepted, not only for the local symptoms arising from the miasm of sora, but also and especially for those originating in the miasm of syphilis or psychosis. For the simultaneous local application along with the internal employment of the remedy in disease whose chief symptoms is a constant local affection has this great disadvantages that by such a topical application these chief symptoms local affection will usually be annihilated sooner than the internal disease, and we shall now be deceived by the semblance of a perfect cure, or at least it will be difficult and in some cases impossible to determine from the premature disappearance of the local symptoms. If the general disease is destroyed by the medicine simultaneous employment of the internal medicine. This is lastly the internal medicine is there, that is by the simultaneous employment of the internal medicine. So this is the aphorism number 197, and it explains about that is application of medicine internally as well as externally. It is inadmissible, means it is not accepted. So what is given in aphorism number 196, it is not accepted in aphorism number 197. So the reason given behind it why it is not accepted, so in this they explain about that is because when in a dynamic local diseases same medicine is administered internally as well as externally, there occurs premature eradication of the symptoms of local disease prior to restoration of a state of health of a man. Hence, forward the physician is handicapped for further management of the case because these are the diseases which have very few symptoms, and if there occur premature disappearance of such symptoms, nothing remain which guides for further treatment. So in this they explain about that is when you are giving the same medicine internally and externally also, that is after giving the same medicine internally and externally, in that case there occurs a premature eradication of the symptoms, as when you use the same medicine externally also, in that case the what is the external symptom present in that patient, that gets eradicated, and that is the premature eradication of the symptoms of the local disease, and in this way that symptoms get eradicated in local disease prior to the restoration of a state of health. It is occur prior to the restoration of health, means without curing the internal disease, only the external disease symptoms gets eradicated, but the internal disease not completely recover, or the prior to the restoration of state of health of a man, and hence forward the physician is handicapped for further management of the case, and due to the eradication of these local symptoms in the hand of physician there is nothing remains, and hence we call it is a handicapped condition for the physician, as we know that the local diseases are a type of one-sided diseases and it having only a few symptoms present in it, and which is only on the external part of a body. So to complete the action of this medicine there is nothing remain in the hand of physician, as all the external symptoms get eradicated earlier than the internal disease, and in this way there is nothing in the hand of a physician to treat that patient, and if there occurs premature disappearance of such symptoms, nothing remains which guides for further treatment. So for the further treatment there is nothing remains in the hand of physician, and in this way the disease becomes incurable when you use the same medicine externally and internally also in the case of a dynamic local diseases. So this is aphorism number 197, as not to use a same medicine internally and the externally, and why it is not used, the reason given in this aphorism, that is aphorism number 197. So all of you understand about the 197? Yes, all are listening? Okay. Now we will see the next aphorism, aphorism number 198. So aphorism number 198, which explain about, that is the local melodies, external application and harmful effects of it. It is the mere topical employment of medicines that are powerful for cure when given internally to the local symptoms of chronic miasmatic diseases is for the same reason quite inadmissible. For if the local affection of the chronic disease be only removed locally and in a one-sided manner, the internal treatment indispensable for the complete restoration of the health remains in dubious obscurity. The chief symptoms, the local affection, is gone and there remain only the other less distinguishable symptoms, which are less constant and less persistent than the local affection, and frequently not sufficiently peculiar and too slightly characteristic to display after that a picture of the disease in clear and the peculiar outlines. So what it explains about, that is the local maladies, external application and its harmful effects. So in this they explain as the external application is not admissible in the treatment of local maladies, as we also studied it in aphorism number 197, that is the external application is not admissible in the treatment of local maladies, from the reason above stated as well as after external local application the disease gets cured in a one-sided manner, as when we use the external application, or in this they explain as the external application is not admissible, and the why it is not admissible, the reason given above, as well as after external local application the disease gets cured in a one-sided manner. So in that case the disease gets cured in a one-sided manner and the chief symptoms gets eradicated. So in this, when we use the external application, what is present in that case, that is only the external symptom or the local symptom present on the external part of a body. But when you use the some external application, the symptoms gets eradicated and the chief symptoms also gets eradicated, and there remains only those symptoms which are not characteristics. So in that way the chief complaints and the characteristic symptoms also get eradicated, and those symptoms which are not characteristic as well as which are not peculiar, which are not helping for proper selection of simillimum and the follow up of treatment. So in this way, when you use the local melodies for treating the local melodies as external application, by using this external application there is a palliation of these external symptoms, and in the hand of physician there is nothing remain, as we know that the local maladies are a type of one-sided diseases having only few symptoms which is present on only the external part of a body, and when we use the external application these external symptoms gets eradicated and there not remain any characteristics, any peculiar symptoms in that case, and it is very difficult to find out the simillimum or selection of simillimum and to treat the follow-up cases of these local maladies. So in aphorism number 198 they also explain that is the local melodies having external application have harmful effects on the patients. That is, the case is not treated accurately or in a uh, ideal way, or there is a only the that palliation of these external symptoms, and the whole state of man cannot go into the state of health. Then they explain about the aphorism number 199. In 180 it is somewhat like of 197. Now we will see the next aphorism, that is aphorism number 199, and what it explains. Aphorism number 199: if the remedy perfectly homeopathic to the disease had not yet been discovered at the time when the local symptoms were destroyed by a corrosive or a desiccative external remedy, or by the knife, then the case becomes much more difficult on account of the too indefinite, uncharacteristics and inconstant appearance of the remaining symptoms. For what might have contributed most to determine the selection of the most suitable remedy and its internal employment until the disease should have been completely annihilated, namely the external principal symptom, has been removed from our observation. So, in aphorism number 199, they explain about that is the dynamic local melodies and the adynamic remedial agents. That is, if the remedy is perfectly homeopathic to the disease had not yet been discovered at the time when the local symptoms were destroyed by a corrosive or a desiccative external remedy. That is, when we use some external application or external remedy, that is in the form of a corrosive or a desiccative external remedy, or by the knife, if we cut some external part and in that there is no any symptom remain, that is for the selection of remedy, or the perfectly homeopathic to the disease had not been discovered. So in this there is, then the case comes much more difficult on account to indefinite, uncharacteristics and inconstant appearance of the remaining symptoms. So after removal of these characteristic symptoms by the different external mode of treatment, there is no remaining any characteristics or any peculiar symptoms in that case, and in that way, for what might have contributed most to determine the selection of a most suitable remedy, and in this way it is very difficult to find out the simillimum in that case and its internal employment until the disease should have been completely annihilated, namely the external principal symptom has been removed from our observation. So in that case, so what is you have to annihilate it by the ideal way of treatment, it is removed from our observation, and it is very difficult to treat that cases. So in this they also explain that is the dynamic local melodies, if prior to proper selection of homeopathic remedies gets palliated with the help of adynamic remedies like mercurial preparations or by surgical means, then the case becomes very difficult to treat as in that case there there is no remaining of any peculiar or characteristic symptoms, and in that way that local dynamic local melodies, if prior to proper selection of homeopathic remedies gets palliated with the help of adynamic remedies like mercurial preparations or by surgical means, then the case becomes very difficult to treat. So this is aphorism number 199, which explain about that is there the disease becomes more incurable and the case becomes very difficult to treat if you use the external application in the case of dynamic local melodies. So this is aphorism number 199. Then the next aphorism is aphorism number 200. So up till now all of you understand or any difficulty regarding it? Yes? Okay, now the last three aphorisms are remaining. We will see that aphorisms. So next aphorism is aphorism number 200. So what it explains, that is, had it still been present to guide the internal treatment, the homeopathic remedy for the whole disease might have been discovered, and had that been found, the persistence of the local affection during its internal employment would have shown that the cure was not yet completed, but were it cured on its seat, this would be a convincing proof that the disease was completely eradicated and the desired recovery from the entire disease was fully accomplished, and intensimable, indispensable advantages to reach a perfect cure. So what it explains, that is, the local disease and the sign of homeopathic cure, that is, the local diseases with sign of homeopathic cure, how it is cured. So in this they explain as, that is, when the local disease, or when in a local disease internal homeopathic remedies are administered on the basis of local symptoms as well as on the whole being jointly, if after use of such internal homeopathic remedies local symptoms gets eradicated, this is the convincing proof of homeopathic cure. So in that, when you use the homeopathic remedy for the local diseases, in that, and that homeopathic remedy is selected on the basis of, Yes, can I audible? Okay, so we are discussing the aphorism number 200, and in this aphorism they explain about that is the local disease and the sign of homeopathic cure. That is what should be the sign of homeopathic cure. So in this they explain as when in local disease internal homeopathic remedies are administered on the basis of local symptoms as well as symptoms of whole being jointly. That is when we give the internal homeopathic remedy, it is based on the local symptom also and the symptoms of whole human being also, and it after use of such internal homeopathic remedies the local disease symptoms gets eradicated. This is the convincing proof of homeopathic cure. And in that when using the internal homeopathic remedy the local symptoms gets eradicated, and this is the proof of homeopathic cure. That is, the homeopathic medicines can cure the external complaints also and the internal complaints also. So this is regarding the aphorism number 200. That is, in this they only explain about that is the homeopathic cure takes place, or the homeopathic remedies can cure the external complaints also and the internal complaints also with the help of internal homeopathic remedies. Then the next aphorism is aphorism number 201. So in this aphorism, first I will read the aphorism. That is, it is evident that man's vital force, when encumbered with a chronic disease which it is unable to overcome by its own powers, instinctively adopts the plan of developing a local malady on some external part, slowly for this object, that by making and keeping in a diseased state this part which is not indispensable to human life, it may thereby silence in the internal disease which otherwise threatens to destroy the vital organs and to deprive the patients of life, and that it may thereby, so to speak, transfer the internal disease to the vicarious local affections, and as it were draw it thither, the presence of the local affections thus silences for a time the internal disease, though without being able either to cure it or to diminish it materially. The local affection, however, is never anything else than a part of a general disease, but a part of it increased all in one direction by the organic vital force and transferred to a less dangerous external part of the body in order to allay the internal ailment. But as has been said, this by these local symptoms that silences the internal disease, so far from the anything being gained by the vital force towards diminishing or curing the whole malady. The internal disease, on the contrary, continues in spite of it gradually to increase, and nature is constrained to enlarge and aggravate the local symptoms always more. Warts increase and grow while the psychosis is not cured, whereby the latter is rendered more and more difficult to cure, just as the general internal disease continues to increase as time goes on. So, this is aphorism number 201, and in this they explain about that is delay in the treatment leads to increase in the physical illness. That is, if you make the delay in the treatment of local diseases, that leads to the increase in the physical illness of a human being, and in this, when a man as a whole is fully drowned under the morphic influences, the vital force in order to maintain the state of internal vital organs have a manifestation of disease on the other aspects of the body in the form of local maladies. And in this, the disease of a man as a whole and the local maladies, they are not two different entities, but they are one and the same. If proper treatment is not given to local symptoms, that aggravates and the aggravates. So in this, they want to tell you that is, if you are not treating that local diseases properly, that may leads to the increase in the physical illness of that patient. That is, when a man as a whole is fully drowned under the morphic influence, as we know that there is only not a external application, but along with this the internal man also gets affected. And in this, the vital force in order to maintain the state of health of internal vital organs have a manifestation of disease on the other aspects of the body in the form of local maladies. That is, when the internal man gets deranged, or there is a derangement of an internal vital force, that vital force to maintain the state of health causes the internal vital organs have a manifestation of disease on the other aspects of a body in the form of local maladies. That is, they show their symptoms in the form of a local maladies. And if disease of a man as well as a whole and the local maladies are not the two different entities, that is, if there are some local entities or local maladies and the disease of a man are not two separate entities, that is, these are not two separate things, so but they are one and the same. That is, there is something internally deranged, that internally deranged state causes the appearance of local maladies or the symptoms on an external part of a body, and these two entities are the same. As you are not treating these two entities simultaneously or considering one and the same, the disease cannot be cured. And if proper treatment is not given, the local symptoms aggravates and the aggravates. So in that case, the local symptoms also gets aggravated, as you are not giving the internal remedy to heal that internal man also, and the symptoms which are present on external part of a body also. So it is very important to treat these diseases in a proper way or in a proper time. That is, do not make delay to treat these external or local diseases also, or that local diseases that are caused due to the internal derangement also. So you have to give the proper homeopathic remedy based on a symptom similarity that will eradicate that local maladies or the local manifestation, as well as the derangement of the internal man also. So this is regarding the aphorism number 101, that is, not to delay in the treatment of these local diseases or the local maladies, as this affects the internal and the external man both. So this is aphorism number 101. After this, the next aphorism is aphorism number 102. So what it explains, that is, if the old school physician should now destroy the local symptom by the topical application of external remedies, under the belief that he thereby cures the whole disease, nature makes up for its loss by rousing the internal malady and the other symptoms that previously existed in the latent state side by side with the local affection. That is to say, she increases the internal disease. When this occurs, it is usual to say, though incorrectly, that the local affection has been driven back into the system or upon the nerves by the external remedies. So in this they explain about, that is, the local maladies and the allopathic treatment. That is, when you use the some external application or the allopathic mode of treatment for the local maladies, what happens for that internal disease condition. So in this they want to explain that as this system of medicine has materialistic view of the disease in mind. That is, what is the allopathic concept? That is, it having a materialistic view of the disease in mind, that man as a whole is a material, can be deranged by material morphic agent, and can be cured only by material medicine as a remedy. As you know that it consider a materialistic view of the disease in mind, they consider that the man as a whole is a material, and that material can be deranged by only a material morphic agent, and that can be cured by the material medicines as a remedy. So to treat that material disease, they require the material medicine. But local diseases, as they are due to internal dynamic morphic agent, if treated with the help of external palliative mode of treatment, they get suppressed and one becomes the victim of local disease of more vital organs of the man. And when you suppress that external diseases with some external morphic agent, the disease goes inside the body, more inside, and in this the whole system gets affected, and the vital organs of the man, that is, it affects the more vital organs of the man. And that is, though it is incorrectly that the local affection has been driven back into the system and upon the nerves by the external remedies, and the disease goes inside and inside, and that affects the whole human being. So this is not allowed to use the external application for these local maladies, but this is the concept of allopathic treatment, that they consider the material, or they having a materialistic view, that is, man is made up of material, or man as a whole is a material, and can be deranged by material morphic agent, and can be cured by material medicine as a remedy. So they use the external application for treat that local maladies. Excuse me. But in homeopathy we not allowed to use the external application to treat that local diseases or local maladies, as we know that these local maladies are caused due to the internal disturbance in the whole human being, and to treat that local maladies you have to require the medicine which is based on the local symptom as well as the human being as a whole, and you have to form the totality and select the simillimum to treat that disease condition. So this is aphorism number 202. After this, the last aphorism, aphorism number 203. So aphorism number 203: every external treatment of such local symptoms, the object of which is to remove them from the surface of the body, whilst the internal miasmatic disease is left uncured, as for instance, driving off the skin, the psoric eruptions by all sorts of ointments, burning away the canker by caustic, or destroying the condylomata on their seat by the knife, the ligature, or the actual cautery. This pernicious external mode of treatment, hetero is universally practiced, has been the most prolific source of all the innumerable named or unnamed chronic maladies under which the mankind groans. It is one of the most criminal procedures the medical world can be guilty of, and yet it has hetero been the one generally adopted and taught from the professional chairs as the only one. So what it explains, that is, the when local diseases are treated with local medicine externally, the cause of a disease remains uneradicated. So in this aphorism mainly they explain as, that is, every external treatment of such local symptoms, that is, if you use the external treatment for such local symptoms, the object of which to remove them from the surface of body, whilst internal miasmatic disease is remain uncured, that is when you use the external mode of treatment for these local symptoms, in that case the internal miasmatic disease remains uncured or is left uncured. That is, for instance, they give the different examples as, that is, driving of skin, the psoriatic eruption by all sorts of ointments. That is, if there are some eruptions on a skin, in that case you use some ointments. So this is the suppression of that eruptions that leads to the internal cause of disease, that is sora, and with that burning away the canker by caustic or destroying the condylomata. And canker is a, that is, eruption you see in the syphilitic miasm, and when you remove that syphilitic miasm or when you remove that canker, that leads to the syphilitic miasm. And when you remove, that is, condylomata on their seat by the knife or a ligature or actual cautery, in that when you remove that condylomata, that leads to the psychotic disposition. And this pernicious external mode of treatment hetero so universally practiced, and this mode of treatment is universally practiced in the worldwide, and in this way the that human being leads to the more chronic diseases that having the miasms, that is psora, psychosis and syphilis, that gets developed after the removal of eruption, removal of canker, removal of condylomata, and the disease gets more severe and severe in the worldwide, and it remains as uncured in the form of, or the internal cause of disease remains uncured or uneradicated. Only there is a palliation of or a suppression of the external local symptoms. So this is not a ideal way of practice to suppress that psoriatic eruptions, then cut the canker or cut the condylomata, that leads to the serious disease conditions that having the psoriatic, psychotic and the syphilitic miasm may gets developed in that patient. So it is not advisable to use the external mode of treatment to treat the local maladies. So this is when the local diseases are treated with medicines externally, the cause of a disease remains uneradicated. That is, the cause of disease may remain uneradicated. There is only the palliation or suppression of these local symptoms. So in that way we finished the aphorism number 103, and in this way we finished the aphorism number 185 to 203, in which they explain about the local maladies. It is one of the type of a one-sided diseases. Local maladies means symptoms appears on a external part of a body, that we call it as a local maladies or a local diseases. It may be in the form of adynamic local diseases or it may be in the form of dynamic local diseases. And in the adynamic form of local diseases, you can take the help of external aid of treatment, that is of surgery or some mechanical aid, but the cause is external cause. But when the local symptoms are of dynamic nature, that is dynamic local diseases are present, in that case you have to give the internal remedy to cure that disease condition permanently, and that internal remedy selection is based on the totality of local symptom as well as the human being as a whole, and you have to select the proper similimum medicine for these cases. And in this they explain the different modes, that is using of external application or using the same medicine internally or externally. And it is not advisable in homeopathy, that is using the same medicine internally or externally, because when you use the same medicine internally and externally, that same medicine eradicates the external symptoms more rapidly than the internal symptoms, and the whole picture of disease gets diminished, and there is nothing in the hand of physician to treat that patient permanently, so that disease may becomes incurable. So in that way we finish the aphorism number 185 to aphorism number 203. So all of you understand about these aphorisms or any difficulty regarding these aphorisms? All of you understand?
Yes, ma'am.
Okay, so in this way we finish the local maladies. After this, the next part is of chronic diseases. They explain in aphorism number 204 to 209, that is regarding some chronic diseases. And after this, the 210 to 230, it is regarding the mental diseases. So, but prior to this, in next week, we will take the topic that you told to take about second year. So, in next week, we will take the logic, similar diseases, dissimilar diseases, memory, and someone want that is of totality of symptoms. So, we will try to finish this topic in the next week. So, all of you understand or any difficulty? So, we will stop here.
Yes, ma'am.
Okay, Bharti, please send attendance. I think she left. Okay, so we will stop here. Bye, everyone.